in both ovarian and breast cancer, you have a lot of treatment options. And in our studies, we can't control for what the patient gets after the patient progresses on the study therapy. The patient essentially comes off study and is followed for survival. You start introducing then, at random, if you will, additional lines of treatment. And in the case of ovarian cancer, that may go up to as many as 8 or 10 lines of therapy in some instances. To think that that doesn't have an impact on the patient's overall survival is just foolish. And with all of those additional variables, to think that you can get a clean comparison of survival from the original frontline or second line study comparing regimen A to regimen B is, I think, personally, is equally foolish. Therefore, you need an endpoint that's going to give you a clean comparison between the two. And progression-free survival seems to be, at least to me, the optimal endpoint. And we've shown that we can actually assess progression-free survival in a consistent fashion by the bevacizumab data alone. We've got 4 separate large randomized phase 3 trials run by 4 different groups that all show the same thing.